Hello doctors, I am Dr. Vijita. Today I am going to talk about DNB Final Exit Exam. Majority of you have requested this video. I have created a poll before that and I got more than 70% vote for this topic. So here we start. So DNB practical exam is organized in two sessions, one in June session, another is December session. And for circumstances it may prepone or postpone, like this year the final winter session had happened in October. So there are two parts of this DNB final exam. One is theory exam and one is practical exam. Theory exam is of 400 marks and practical is of 300 marks. Generally, there is more than 2 months gap between theory and practical, but this may vary according to the circumstances. Now we are going to talk about what happens in theory and what happens in practical exam. In theory exam, there are 4 papers in each degree course. In general medicine, first paper of general medicine contains basic anatomy and physiology, pharmacology, genetics, etc. Second paper contains general medicine, third paper contains super specialty subjects, and the fourth paper contains recent advances. Now coming to the pass marks. You have to get 50% in your theory exam to appear for your practical exam. Registration for theory and practical exam happens separately. If you pass your theory exam, then only you can appear for the practical exam. Total 400 marks is there in theory examination, out of which if you get 192 marks, you will get grace marks and you will be passed. Now you will get option to choose your exam city during application fill up. So you can choose your nearby center. You will get 2 options and in most of the cases you will get your first choice only. Now coming to the most dreaded part of DNB final exam, that is DNB final practical exam. You have to go to another city for appearing for the practical exam. Each of the examiners will be external for you. 2 examiners will be from that institute only and 2 examiners will be traveling from other states just like you. In practical exam, you don't wear your name anywhere. You may attach your roll number to your apron, that is enough. No one will going to ask you your name, from where you have come, anything. So your identity will not be disclosed. And that is the core to the transparency of this exam. First, you will sit for OSCE examination. Live video will be telecasted on a giant screen. There are 20 OSCEs and for each OSCE, you will be given a separate answer sheet. You may have to write your roll number on that paper, but I don't think you will need to write your name anywhere during the exam. So there will be 20 OSCEs. You have to pass the OSCE set separately, like you have to get 50 marks. And after the OSCE session is over, you will get to the long cases. There will be 2 long cases, 50 marks each. So 50 plus 50, 100 for long cases. Then you will go for ward rounds or your short cases. There will be 4 cases and 4 into 10, 40 marks for ward rounds or short case. And after completion of patient oriented exam, you will sit for table viva. There will be 4 tables, 15 marks each. So 4 into 15, 60. So here 100 for OSCE, 100 for long case, 40 for short case or ward rounds and 60 for table viva. So this is the division of 300 marks in practical exam. You have to carry your logbook and your hardbound thesis to your practical exam. You may be asked to show that. And there is a separate table for thesis viva and logbook viva. So you have to be prepared. And in the practical exam, you have to get 152 pass. So here I have complete summarizing all the important things you must know about DNB final exam. I hope this video helps.